I'm Kramolis. I'm an MD-MPH candidate at the University of Wisconsin, working with ABC for Health, and I'm here with Dr. Dipesh Navsaria, Pediatrician in Madison.
Hi, I'm an Associate Professor of Pediatrics at the University of Wisconsin School of Medicine and Public Health. I also direct the MD-MPH program and am current Vice President of the Wisconsin chapter of the American Academy of Pediatrics.
He's a busy guy. So we're here today to talk about HealthCheck. HealthCheck is Wisconsin's name for a federal law called EPSCT, which stands for Early Periodic Screening, Diagnosis, and Treatment. So anyone under the age of 21, children and young adults who is eligible for Medicaid is eligible for HealthCheck. And the main component of HealthCheck was having these individuals who are eligible for Medicaid under the age of 21 have access to comprehensive screens, or what we know as well-child checks, according to the American Academy of Pediatrics periodicity schedule.
So this is really important because in the healthcare world, we often don't use the term health check, and if I say EPSDT, I get a lot of frowns. Like, I think I've heard of that. These are the standard checkups, health supervision visits, well-child checks. All of these mean the same thing. So I just want to make sure that people are being a little demystified about what this is. These are all talking about the same sort of thing.
Definitely. And of note, really important parts of these screens are vision screens, hearing screens, dental screens. It's really a fully comprehensive screen, which is being done in a pediatrician's office or a primary care office. We've alluded to HealthCheck is a very important program that is aimed toward preventing medical problems before they arise, and then providing access to services and coverage for any medical problems that may be detected on those screenings. So there's three really important parts to HealthCheck. So those comprehensive screenings that we talked about, and then if anything is detected on those screens or at any other what we call interperiodic screens or problem visits or specialist visits, if any medical problem is detected and needs to be treated, it may be covered by something called HealthCheck Other Services, which basically means even if something is medically necessary, a treatment is medically necessary, even if it is not covered by the state's Medicaid program, if it is deemed medically necessary by the pediatrician for that child or young adult, the state has to cover it. So it's an kind of increased access for things that are medically necessary, especially for children and youth with special healthcare needs whose treatments may be more expensive than standard treatments.
I think this is really important because this may seem obvious to us, like, well, of course these things should be covered, but this means that the law actually says very clearly that it doesn't need to be only at the regular checkups, that it can be at these interperiodic visits, the problem-based visits or specialist visits or whatever. And if something is found, it needs to be covered, rather than saying, no, you can't do that at this kind of visit. So there's actually essentially legal protections to make sure that kids are getting what they need.
Exactly. Because if we think about it, it's really not ethical to say, we'll cover your screens, but if we find something and diagnose you with it, you're responsible for the treatment. A lot of families actually before this part of HealthCheck law, EPSCT law, a lot of families were not able to cover the treatment component. And so they were kind of left in the dust, like, oh, well, I know my child has this now, but I can't do anything about it.
And many healthcare providers would actually say, well, if we can't do anything about it, why screen?
Exactly.
So then this also led to other issues as well. So it's really a well thought out law that's been highly successful for decades, really.
Yeah, definitely. So the third component, which we won't get into in this webinar, is kind of an outreach and case management component, which is aimed to just make sure that anyone who is eligible for HealthCheck, which means anyone who's eligible for Medicaid under the age of 21, knows that it exists and is able to access its services. So like we said, if a medically necessary service is not typically covered by Wisconsin or a state's Medicaid, it may be covered under HealthCheck Other Services. So the big thing about HealthCheck Other Services that's important with the definition of medical necessity is that this definition is expanded under this law. So for children and youth, especially children and youth with special healthcare needs that may need access to treatment that isn't typically covered under Medicaid, the definition of medical necessity includes preventing regression or even just maintaining the same level of care. It does not have to correct or improve the condition as long as it prevents regression. And this is an expanded definition of medical necessity compared to adult treatments.
And I think that's important because sometimes people say, well, you're not actually fixing the problem or the issue, therefore it shouldn't be covered. Well, no, preventing a situation from worsening is also valid, and that's important to know.
Definitely. So if a provider feels that a treatment is necessary that's detected on any of these screens, they would order a prescription, even if it's something that would typically be over the counter. They would still need to write a prescription because some over the counter medications are covered by HealthCheck Other Services. And this can be any provider who takes Medicaid patients. So we talked a little bit about this, but some examples of things that may be covered by HealthCheck Other Services are things like durable medical equipment, so things that help make the home more accessible for children with special healthcare needs, wheelchairs, therapies like occupational, physical, or speech therapy, rehabilitation services, some mental health services. There's a whole list of services that can be covered by this, and really it depends on providers writing solid prior authorizations, which do you want to explain a little bit about what a prior authorization is?
So prior authorizations, I think for many people is the bane of their existence. They feel, oh no, I don't have the time to do this, and I don't know how to do this well, and so on. Prior authorization is a request to an insurance company to say, yes, we will cover this when the request comes through, essentially. So otherwise we'd have this bizarre situation where things would be provided, and then if it's not covered, the family's on the hook for the bill, right? Which is just not a great way to do that. So prior auths do serve an important function. Wisconsin Medicaid uses them to determine, is this a medically necessary service, and so on. And most of these things that you just talked about that are considered other services require a prior authorization because they want to make sure that these things are being well used and properly used for the situations in which they're being deployed.
Exactly. So it's really important for physicians, and I don't have much experience as someone who's not a physician yet in filling these great forms out, but it's really important to thoroughly describe why the service is medically necessary, correct, for the patient on the prior authorization?
You're correct, and as you know, they don't teach this in medical school, right? And they don't teach this in residency either. So I think most healthcare providers feel discomfort. Am I doing this right? Which is part of why we're doing this webinar.
Definitely, definitely. So another very important thing to, another really important thing to talk about with prior authorizations is now with how HealthCheck is working, if a prior authorization to Medicaid for a service for one of your patients is denied, it should automatically go through be looked at through a HealthCheck Other Services lens if the patient is under 21. And sometimes we found in the state that this isn't yet happening. It's a relatively new change. And so it's important if you get a denial for a service that you feel is medically necessary and that you've explained well why it's medically necessary, that you appeal it or use some sort of informal process to figure out how you can reverse that denial.
This was a really important point that I learned from you folks here at ABC for Health, that that previously you had to essentially make an appeal every single time. And I think most healthcare providers don't know that this other services category even exists. So to know that at least in theory, now the policy is that there's an automatic referral is great, but we also know that that isn't always working in every case, so it's still good to follow up. But knowing what should be happening and knowing that policy is attempting to work and work in good ways is a good thing. I'll just say that, when we started having this conversation about HealthCheck Other Services, I and some of my colleagues were just quite puzzled. HealthCheck, that's what we do with the EPSDT services, the regular checkups, all that. Why do we think that's not being done? And then being educated about the other services piece and about thinking about are the prior authorizations being done? Are the denials being appropriately sent over to the other services bucket? I think is really the key take home for me. I think most pediatricians continue to do their good work with well child care, with health supervision. You should continue doing that. but know that there's this element of these other services that really needs to be addressed. And thinking about the prior authorization process is really what for me was really stood out.
Definitely, because there is a set amount, there is Medicaid funding for this program that is not being used because people don't know about it. So we talked about how there were some recent changes in the prior authorization process, and that Medicaid prior authorizations are automatically looked at through HealthCheck Other Services if they're initially denied for a patient under 21. And that is laid out really well in Forward Health's provider bulletins, which you can find at the second link there. We also have a webpage, an ABC for Health HealthCheck webpage that you can check out that has a lot of information for families, patient advocates, and providers. And then you're welcome to contact ABC for Health at the link or the phone number below to ask more questions about this. We'd love to talk more about it if it's something you're interested in. So thank you so much, Dipesh, for coming in. We really appreciate having your insight as a pediatrician and your advocacy for this program.
Yes, and thank you. From the perspective of the Wisconsin chapter of the American Academy of Pediatrics, it's great to partner with organizations like ABC for Health that are really watching out for patients' needs and making sure that we all get them what they need.
Yeah, great.
Thank you.